Chest pain is one of the most alarming symptoms that can indicate serious health conditions, including heart disease, cardiovascular disease, and even life-threatening emergencies like heart failure or the need for stroke treatment. However, not all chest pain is related to the heart. Some cases may be linked to arthritis, joint pain, nerve issues, or even digestive problems. Understanding the difference between minor discomfort and a warning sign of a major illness is crucial, as untreated heart problems, diabetes, and kidney disease can lead to long-term complications. Seeking medical attention from a cardiologist or heart doctor, undergoing an EKG, and monitoring blood sugar and glucose levels are essential steps in protecting your health. One of the most dangerous causes of chest pain is heart attack-related pain, often described as a crushing, tight, or squeezing sensation in the chest. This type of pain occurs when blood flow to the heart is blocked due to cardiovascular disease, increasing the risk of heart and stroke complications. The pain may radiate to the left arm, jaw, or back, and is often accompanied by sweating, shortness of breath, and nausea. Individuals with diabetes, especially those undergoing type 2 diabetes treatment, are at higher risk of silent heart attacks, meaning they may not experience typical symptoms. If chest pain lasts for more than a few minutes or worsens with activity, immediate emergency care is required, as delaying treatment can lead to heart failure or permanent heart damage. Sharp, stabbing chest pain that worsens with deep breaths may indicate pericarditis, an inflammation of the lining around the heart. This condition can develop after a viral infection, or as a complication of kidney disease, rheumatoid arthritis treatment, or autoimmune disorders like psoriatic arthritis symptoms. Unlike heart attack pain, pericarditis-related chest pain often improves when sitting up or leaning forward, but worsens when lying down. A cardiologist can diagnose this condition using an EKG and imaging tests, and treatment typically involves anti-inflammatory medications or arthritis supplements to reduce inflammation. Heart arrhythmia-related chest pain, caused by abnormal heart rhythms such as atrial fibrillation, can create a sensation of fluttering, pounding, or tightness in the chest. Atrial fibrillation increases the risk of blood clots and stroke, making early diagnosis and stroke treatment essential. Many people with diabetes and chronic kidney disease are at higher risk of developing heart arrhythmia, as these conditions affect blood circulation and insulin regulation. A heart doctor may recommend lifestyle changes, medications, or procedures like catheter ablation to manage irregular heart rhythms and prevent complications. Chest pain due to acid reflux or GERD is often mistaken for heart-related issues, but it originates from the digestive tract rather than the heart. Acid reflux occurs when stomach acid flows back into the esophagus, causing a burning sensation in the chest, also known as heartburn. This type of chest pain may worsen after eating, lying down, or consuming acidic foods, and is often relieved by antacids. While GERD itself is not life-threatening, chronic acid reflux can damage the esophagus and increase the risk of esophageal cancer. Managing blood sugar and following a balanced diet, similar to a type 2 diabetes treatment plan, can help reduce acid reflux symptoms. Costochondritis, an inflammation of the cartilage connecting the ribs to the breastbone, can cause localized chest pain that worsens with movement or pressure. This condition is commonly linked to arthritis, joint pain, and autoimmune disorders like psoriatic arthritis symptoms. People with rheumatoid arthritis treatment needs may experience costochondritis flare-ups, making it difficult to differentiate between joint inflammation and heart-related pain. Using arthritis supplements, applying heat therapy, and following a proper shoulder pain treatment or knee pain relief plan can help manage costochondritis discomfort. Panic attacks and anxiety-related chest pain can mimic heart attacks, leading many people to seek emergency care out of fear of a cardiac event. Anxiety-induced chest pain often includes rapid heartbeat, dizziness, and difficulty breathing, but it does not typically cause long-term damage like a true heart attack. However, frequent anxiety episodes can contribute to cardiovascular disease and worsen conditions like heart arrhythmia and atrial fibrillation. Managing stress through breathing exercises, therapy, and heart-friendly activities can help prevent recurring anxiety-related chest pain. Pulmonary embolism, PE, is a life-threatening condition where a blood clot travels to the lungs, causing sudden and severe chest pain, shortness of breath, and a rapid heart rate. Individuals with kidney disease, diabetes, or a history of stroke treatment are at higher risk of developing blood clots. Chest pain from a pulmonary embolism typically worsens with deep breaths and may be accompanied by leg swelling, a common sign of deep vein thrombosis, DVT. A heart doctor may order imaging tests, blood thinners, or emergency procedures to remove the clot and prevent heart and stroke complications. Lung infections, such as pneumonia and pleurisy, can also cause chest pain, especially if there is difficulty breathing, fever, or coughing up mucus. Pleurisy occurs when the lung lining becomes inflamed, often due to infections or underlying kidney disease. This type of chest pain worsens with deep breathing, sneezing, or coughing, and may require antibiotics, anti-inflammatory medications, or supportive respiratory treatments. Since diabetes and chronic kidney disease weaken the immune system, individuals with these conditions are more susceptible to lung infections, making early intervention critical. Chest pain from musculoskeletal injuries, such as a pulled chest muscle or rib fracture, can result from heavy lifting, sports injuries, or accidents. This type of pain worsens with movement, deep breaths, or pressure applied to the affected area. Many people with arthritis, joint pain, or ankle pain experience increased musculoskeletal discomfort, especially if they lack proper joint pain relief strategies. Rest, ice, arthritis supplements, and physical therapy are often effective treatments for chest-related musculoskeletal injuries. Nerve-related chest pain, including conditions like shingles or pinched nerves, can cause burning or stabbing sensations in the chest. Shingles, caused by the reactivation of the varicella-zoster virus, affects nerve pathways and can lead to persistent chest pain even after the rash disappears. This condition is more common in individuals with weakened immune systems, such as those with diabetes, chronic kidney disease, or kidney failure treatment without dialysis. Antiviral medications, nerve pain treatments, and best joint pain relief methods can help manage shingles-related discomfort. Recognizing the cause of chest pain is critical for determining whether it requires emergency care or a specialized treatment plan for heart disease, arthritis relief, or kidney disease treatment. Individuals experiencing chest pain alongside symptoms like dizziness, difficulty breathing, or extreme fatigue should seek immediate medical attention from a cardiologist or heart doctor. Monitoring blood sugar, maintaining joint pain relief, and addressing heart problems early can prevent serious complications and improve overall health.